Are you interested in learning more about using a TENS unit for controlling pain? If the answer is yes, then you've come to the right place. In this video, I'll provide an overview of TENS and how it works to reduce pain. But I'll also tell you how to know when it may not be a safe option for you. And finally, as someone that has trained hundreds of physical and occupational therapists on TENS, I'll provide you with easy to understand examples of how you should expect TENS to feel for you. And because there is so much information on how to use a TENS unit with different conditions, I'll also share with you my plans for making a series of upcoming videos on this topic. My name is Kevin, and I want to thank you for checking out this video. So let's talk about TENS units today. While they are sold over the counter and are generally safe to use, they could cause injury if not used properly. As a doctor of occupational therapy, I've treated countless patients and trained many therapists on how to safely use them. I will share with you valuable information to help you to better understand TENS units and how they work, but without knowing your unique situation, this information should not be seen as a replacement for consulting with your doctor or therapist. However, as the basis of any good healthcare visit, this information can help you start a good discussion with your provider based on your situation and hopefully result in a more productive visit. So what is TENS? Well, TENS stands for transcutaneous electrical nerve stimulation. And as the name tells us, it is a form of electrical stimulation, also commonly called e-stim, that is used for pain. TENS can be delivered in the more powerful, complex units you may have seen in a therapy clinic or in the battery-operated portable devices that can be used at home. For today's discussion, we will be talking about the portable units that are used at home. TENS works by delivering low-voltage electrical current to the tissue where the pain is through electrodes that are placed on the skin. If done correctly, it feels very comfortable. No shock therapy going on here. So why would anyone want to use TENS instead of proven medications for pain? Well, there are a lot of reasons. Primarily that medications, prescription or over-the-counter, can cause unwanted side effects starting with more mild issues such as an upset stomach to more dangerous issues such as increased bleeding and dependence. And in today's world where opioid addiction and the overdose deaths that result from it are at crisis levels, Congress has passed bills looking to maximize non-pharmacological approaches for pain relief. e-stim or TENS would be an example of such an approach. This type of treatment has been around for many years, has been supported in random clinical trials, and has been approved by the FDA. So it's now time to ask, how does TENS actually work to reduce common types of pain? Today we'll focus on how TENS acts to reduce general peripheral neurological pain, or what some people call nerve pain. To keep it simple, this will cover a general perception of pain that is not caused by active swelling or inflammation. That type of pain is treated differently with e-stim, so we'll cover that condition separately in an upcoming video. But as far as answering the question of how TENS can reduce general pain, well, research has identified two different mechanisms on how it works. And those mechanisms can be leveraged on a portable TENS units based on the settings that are selected. The first mechanism is referred to as gate control. Without getting too deep into the physiological details as to how it works, what the e-stim is basically doing is providing a new sensation to overwhelm the pain sensation. So think about a time when you accidentally hit your thumb with a hammer or stubbed your toe hard when you didn't have shoes on. What is the first thing you do? Besides for screaming out something that isn't suitable for this channel, if you're like most people, the first thing you do is to grab and squeeze the thumb you just hammered or squeeze the toe you just stubbed. And the reason you automatically do that is because you subconsciously are providing a sensation to overwhelm the pain. While a squeezing sensation doesn't normally feel great, it feels a whole lot better than the thumping of the pain caused by hitting that hammer on your thumb. TENS, using a gate control setting, seeks to do the same thing, which is to overwhelm the pain using a new sensation. With TENS, this feels more like a tingling sensation. Again, while it doesn't necessarily feel fantastic, it's a lot better than feeling the pain you have. In my experience, there are a few people that absolutely don't like the sensation it provides, although I find if I tweak the settings, they can usually tolerate it. However, I find most people really like the sensation because it masks the pain, and with the right setting, it can almost feel like a massage. And even if it doesn't completely mask the pain, it still should take the edge off. The gate control setting is good for acute or new injuries and provides immediate pain relief. However, once the TENS is removed, the pain relief effect goes away pretty quickly. The other major way e-stim can be set up to control general pain is through an opiate mediated mechanism. Again, without getting too deep into the physiological details as to how it works, What the e-stim is doing is basically promoting the body to release endorphins. You probably have heard of endorphins, most likely in relation to exercise, and may know them as the body's natural painkillers. Sometimes you'll hear someone say how they just started exercising a couple of weeks ago and they say how much better they feel. The truth is, in 2 weeks, they're not already in great shape, but the exercise has facilitated the release of endorphins, and that's why they are feeling better. TENS attempts to mimic exercise, when maybe you're in too much pain to actually exercise, by setting up e-stim to provide a muscle twitch. How I would describe it would be as a tapping sensation. It doesn't hurt, but over time it can feel a bit noxious. Think about a little kid hitting you in the arm over and over. It doesn't hurt, but it can get irritating. If I have someone that doesn't like the sensation, I can generally tweak the settings so that it doesn't bother them, or at least bother them so much. The opiate mediated mechanism is really good for chronic pain. Think of conditions such as arthritis or neuropathies, where by releasing endorphins you can start to feel better, and then it can become more active, which will then release more endorphins without the use of TENS. This mechanism will not provide immediate relief, but its effects are longer lasting than using the gate control mechanism, lasting up to 6 to even 8 hours after the TENS is removed. TENS can be safely used for most people, but you want to make sure it is safe for you. Again, this video is not to replace any advice your doctor or therapist can give you based on your specific medical history. Having said that, one thing I would always advise on is looking at the TENS unit's owner manual and refer to the contraindications section, which tells you conditions where you should absolutely not use the device. You also should review the warnings and precautions, which will tell you if you should consider not using the TENS unit, or if you could use it, but by using extra caution for the particular device you have. This is important for safety and liability reasons. While this is not an exclusive list, what I can tell you is that common contraindications for TENS units are not to use it on someone with an implanted electrical device, such as a cardiac pacemaker, not to use directly over sites of active cancer, not to use over the front of the neck, and also not to have the current go through the head. After all, this is not electroconvulsive or shock therapy that we're doing here. Hopefully that gives you a better understanding of how TENS works. In the next video in this series, I will share with you tips on what to look for in buying a good low-priced TENS unit if you're looking to buy one out of pocket. There are a lot of options, but I want to make sure that you get one that is easy to use, but also has a good bit of functionality without spending a ton of money. After that, we will cover how to set up a TENS treatment safely, then discuss how your TENS unit can be used for different conditions, with each condition having its own video. So definitely subscribe to the channel and hit that notification bell so you don't miss any of these upcoming videos. And if there is a specific condition you would like to learn how TENS might help, please add that in the comments section. I hope you have found this information helpful, and if you did, please let me know by hitting that like button. As always, I hope that we can all learn from each other on how to take little, easy steps in making big improvements in our lives. Thank you again for watching, and until next time, have a great day.